Welcome to the Dante Psychology podcast. My guest today is Hasan. He's a clinical psychologist from Iran who's now living in Australia. He's a published author with multiple books in psychology, as well as a researcher on anxiety and personality. I wanted Hasan on the podcast to explore unique perspectives that he would have having worked across two very, very different cultures, and to see what are the differences between practice of psychology and understanding in mental health across these cultures, as well as potentially what could be learned here in Australia and what lessons he's learned from Australia that he feels would be valuable to integrate back into his own country of Iran. Without further ado, here's Hasan. What are some of the cultural differences you've encountered when practicing psychology, where you've noticed differences between how it worked in Iran and what you've encountered here in Australia?
Main one is the attitude towards seeing a psychologist in Iran. Many people still view going to therapy as something negative, and they fear being labeled by others as a crazy person. And the second thing in my idea is expectation clients have from therapists in Iran compared to Australia. I believe in Iran, people think psychologists are a strong authority figure who must provide direct solution and save their lives. And another major difference is that most people in Iran tend to prefer psychiatrists or psychologists. This is simply because in Iran, psychotherapy sessions are not covered by public insurance, but psychiatric services are covered. And the last one is the nature of trauma. And in Iran, I believe uncertainty is main thing for clients. So by uncertainty, you may say, okay, every anxiety is kind of uncertainty. Yes, but the nature of uncertainty in Iran is different. For example, when clients just going out, they have fear of if hijab police can arrest them or not, or bag snatchers come to them or not, or air and noise pollutions, socio-economical hopelessness, life cost increasing every second, or our currency values just changing, so inflation can be felt every second. So all of this together just made Iranian clients differently than Australian in my idea.
There's a few pieces to that, right? I think that cultural perception of if you're going to see a psychologist or a therapist, that means you're crazy. It's not exactly a unique idea to Iran. I think even in Australia, there's still quite a few people that think this way, but it's definitely becoming less now, right? We use the word destigmatization of mental health care to kind of encourage people to go to get mental health care the same as you'd get health care for your physical body. But I think, especially if you look back more than 30 or 40 years, I think that was definitely true here as well.
Yes, we can find some people in Australia as well looking at this, but we are talking about the majority of people, the culture of, for example, attitude toward seeing a psychotherapist or psychologist. Compared to Iran and Australia, I can say in Iran, people just thinking if they go to seek support by psychologists, they may label as a crazy person, unfortunately.
What are some of the common factors of humanity that remain constant, whether practicing in any country?
I believe regardless of where people live, human beings face common struggles and challenges. For example, feelings of loneliness, getting stuck in their complexity of life, relationship difficulties, being misunderstood by others, or most importantly, searching for value or meaning in their life. They are common aspect of human being nature, and the way these struggles are expressed or dealt with might vary across culture, but in their core, they are the same, I believe.
As it ties back to clinical practice, someone was explaining to me the other day this view of kind of two different views of what psychotherapy is, right? One is this view of we take a mental health illness and we kind of fix it and then that's it. The other is this view that psychotherapy is we take that, we fix it, and then we move beyond. We help the person to self-actualize, to live in line with their values more. So it's not just the removal of pathology, but getting a person more onto that pathway of flourishing. This sounds like a question that I'm already answering, but it sounds like in Iran you would never really be implementing that second type of psychotherapy, right?
Yes, I can say yes.
Yeah. What is your personal perspective on that? Like as a psychotherapist, do you lean more heavily into the treatment of pathology and the reduction of mental health illness, or are you more of the type that tries to help people towards that pathway of self-actualization?
As you may know, every client is different than others. So, yeah, depending on situation, to be honest. But if you ask me about my main perspective, I would say ACT and CBT is my main. But yeah, in some cases, you need only just be an active listener, or even talk about your culture, open up about your family. As you may know, working with First Nation clients in Australia, we advise to just talk more about our narratives, talking about our culture, our family, and this is the best way to build in therapeutic relationship with First Nation. And when I read this, I thought it is a bookish thing, but when I'm just practicing in that communities, I'm seeing they are real facts, When I'm talking to them about CBT, about the other thing, they might just misunderstood me. But when we're talking about our cultures, it is going to work. And as you may know, the therapeutic relationship is around 40% of any change in psychotherapy.
It's quite interesting as well, because in traditional, I guess, CBT or even traditional, just any psychotherapeutic approach from the West, it comes from this origin of, the therapist is behind a curtain, you don't reveal anything about yourself, you don't talk about yourself, there's no self-disclosure, it's, any questions about you get reflected back to the client. But then our understanding of working with First Nations people is very, very much the opposite of that.
Yeah.
Was it difficult to make that adjustment coming from a more traditional training?
Difficulties. The main difficulties for me, adapting myself to Australian culture and ethical guidelines, and it was so challenging for me because the nature of Iran and Australia are completely different. Here, you can easily lose your license forever if you are not practicing by just ethical guidelines or ethical codes. But in Iran, it is not like Australia, to be honest. And here, I believe, especially just overseas psychologists feeling much more stressed than their own country.
Were there many differences between, I guess, the ethical guidelines here in Australia and what was expected or normatively practiced in Iran, or was it just a difference in enforcement of those ethical guidelines?
I believe they are same in book, but how they apply is different. In Australia it is really strict. Opera just can see you anywhere. Anyone can report you easily. For example, in Iran, culturally, reporting someone is not good. People can see it as a sin, as a very rude thing to report someone. But in Australia, people easily can report you if you are not practicing well. Even your colleague can report you. But in Iran, it is really hard to report someone. And if you report, there is not any evidence that what would be consequences, because the regulatory of psychology in Iran, the authorities, the people just giving license to you to work, have not that just power to do things, So yeah, as I said, the main policies in Iran are not supportive psychotherapists and psychological organizations. They have just organizations, but they have not enough power. For example, if someone just practicing in somehow without license, if you report them, it can take lots of time to just they come and just assess them, But here, you have not that feeling to start working without license, and the consequences can be very serious to you. But in Iran, when I was practicing, I noticed someone just practicing in close to my office without license.
Right.
So I couldn't report him because I said it's okay, it is not my responsibility. But here, if I see something like this and not report them, I will lose my own license as well, my certification as well.
Right, because we have the mandatory reporting codes as part of our registration here. Yeah.
Yes.
Yeah. It's very interesting, isn't it? Like in Iran, you're talking about how if you report someone else, that's kind of like a shame on you for reporting them.
Yes.
Whereas here, it's very much, it's the expectation where if you see someone else acting unethically, like you need to say something to stop them from doing that.
Yeah. Because here, the first thing is the safety of community and others. But in Iran, people or even psychologists look at from one cultural and sometimes religious perspective, and it is really hard. And I'm adapting myself here to just mention community first, but in Iran it is a little different.
When you mentioned that sometimes it would be that cultural or that religious perspective, does that ever come into the psychological work in Iran? Like when you worked with clients, did they expect you to take more of a religious framing with things or to adjust your psychotherapeutic techniques to align culturally with them?
Yes, absolutely, because you are practicing in a Muslim country and you will see lots of Muslim people coming to you, and you need to just consider their needs. And if you are not considering their needs, for example, when I was practicing in my office in Iran, I used to just fasten tie, and this appearance showed me, like, for example, I'm not just a religious person. So I mentioned some clients can misunderstood me, but when I'm just fastening a tie and talking about religious, and they know I have enough background of religious, and I can share, I can use them, how they can use religious to cope better, so they feel much more connected with me.
Yeah, okay, so you really had to kind of almost like sell them on the fact that, like, hey, I understand like these religious concepts, so you can relate to them and make the it gives them kind of buy-in to the therapeutic process as well. Is that right?
Yes.
Yeah.
Or even here, sometimes, for example, some client may tell you, I'm not sure about your religion, but in my religious, so we are noticing they are religious, they are Christian, for example, so we need to respect their backgrounds,
Yeah, yeah, I've noticed that as well here. Maybe this is because I guess Australia has a very, very wide mix of religions, including a
Yeah,
lot of people who are non-religious. When people do come in
yeah,
and religion is important to them, they will bring it up, but they bring it up in a way of, Dante, I don't know what your religion is, but for me, this is important, almost as if they're preemptively trying to make sure that I don't step on their toes, like by going against their religious beliefs with any of my
yeah.
recommendations or things like that. What are some of the ways that you've had to change and adapt your therapeutic approach since moving to Australia?
Well, in Australia, I have to adapt my therapeutic approach in several ways. One major difference is that I've learned to expect more direct feedback from clients here. So they are often more open to how they feel about you, the therapy, the tasks we assigned for them, or even about your personality, including your accent or anything. They can easily talk about it. But in Iran, just you are a powerful person and they call you doctor. Most of clients, even if you are not doctor, you are, for example, master of psychology. They used to just call you doctor. So this is different here. Australian feel much comfy and in same level. If you ask them, for example, fill out this form in Iran, they will do it more than Australia. Here they can easily forget it
Yes.
because they believe it is useless.
Forget. I've sometimes given people a form, and on the way out the door, I ask them, like, what's the percentage chance that you're going to complete this? And they'll just look me in the eye and they'll be like, probably like 5%.
Exactly. Exactly. So I had episode that they told me I'm not going to fill this test. I said why? Because it is useless.
Yeah.
But I never seen this in Iran. They say okay, consider it done. I will do it.
One thing that comes to my mind is when I was still learning to become a psychologist and I was receiving a lot of feedback from my supervisors was even about the way that we dress. We don't want to be dressed too formally, right? Like we don't want to wear a suit, we don't want to wear a tie, we don't want to come in wearing expensive clothing or jewelry because we don't want to give the perception that there is like a big power imbalance and that I am this fancy person of authority and you have to listen to what I say. Like we deliberately try to cultivate things. So yes, it's professional. I'm not going to sit here in singlet and a shorts, but it's professional, but in the same way informal, right? There's not a huge power gap, or we're not trying to expand the power gap beyond what's always going to be there.
Yeah, Dante, the human connection and the human relationship is really complex, and when it comes to psychotherapy, it is even more complex, and everybody is different than others. Maybe some clients feel much better with your appearance. Some people just feel completely the opposite. So, as I said, everyone is just different, and if we want to just practice in the same manner with anyone, we may just make just therapeutic mistakes. So we need to keep balance. Sometimes here I'm seeing something from my colleagues. I'm surprised about how they are talking, how they are practicing, how they are just wearing clothes compared to Iran. But I'm just trying to adapt myself with these cultures because people here can feel them. Or here, you have a telehealth, you can expect your client is without any clothes, but you never see this in Iran. Never.
Yeah, people can sometimes take appointments very casually here. Yeah, telehealth especially. It's it's even something where I have to provide like a boundary to people and be like, hey, if we're doing telehealth, A, you can't be naked, or like, B, I can't think that you're naked even if I can't see your lower half. I have to assume you're wearing clothes. And you know, like, and please don't like do it in the living room with your whole family behind you, walking through the camera. Like, go to your bedroom, right? Yeah, some people can take it very casually.
Sometimes using toilet.
Yes. I'll be like, no, put the phone down in that room and go to the other room and close the door, please. Like, don't take me in there with you.
And once I talked to my supervisor about this, for example, I called the client, they're kind of nicked. What is my obligation to do? And my supervisor told me, because I was new in Australia and it was really important for me to know, and she told me, if you are feeling uncomfy, you need to talk to them. I'm just pausing the session, please just put something and I'm waiting you. But if you're feeling okay, it's okay.
Yeah. I think in that directive kind of, that more direct feedback goes both ways, right? Like you mentioned, clients will be more direct to us in terms of like our appearance or their thoughts about worksheets. We, at the same time, can also do the same without necessarily rupturing the therapeutic relationship. Are there any mental health conditions or issues that are more common in Iran than Australia, or vice versa, the opposite way around?
I can say, if compared to Iran, I have more clients with PTSD here, and again, I believe it is because of cultural things. In Iran, talking about traumas is kind of shame, it's kind of barrier. So if they are abused physically, mentally, sexually, they tend to hide it. But here, they easily can report it to police or anyone. So here, I believe, I can't remember in Iran, for example, how many clients I had with PTSD. I mean, it was very limited in the period of time I was practicing. But here, if you have 10 clients, maybe 3 of them present some symptoms of PTSD or episodes related to trauma.
And it comes back again to that societal kind of shame about needing to get mental health support, or a lot of the criteria for PTSD are things where a person is a victim of a crime, and so there's that kind of self like, okay, this was my fault in some way, or I'm a bad person in some way, right? These are very common beliefs that people with PTSD have, and so it makes sense that they wouldn't want to express that to someone else and risk being judged or shamed because of that.
Another thing, it is surprising for me, the diagnosis of autism and ADHD in Australia is very high. For example, sometimes I'm surprising. This is normal person according to my perspective compared to Iran. We can't label this person as a autism in Iran, but here they diagnosed as a autism or ADHD. And this might be because of some client maybe seeking support like NDIS, or in Iran we have not organizations like NDIS to help people with this diagnosis. So I'm surprised by the amount of ADHD. Even in older people, they say, I have ADHD. So I diagnose as ADHD. Or here, for example, people with ADHD or some level of autism can benefit from NDIS. So here is more common, this diagnosis.
Because even in my practice, I do quite a lot of assessments for things like autism and ADHD. But the main purpose of a lot of these assessments is to see, like, can this person get support in work, in school, financial supports with NDIS, or perhaps medication support through their psychiatrist for ADHD, right? But if schools and universities weren't willing to make adjustments, if NDIS didn't exist, no one would be coming to get an assessment, because even if they clearly are autistic, there's no purpose. There's no purpose to being diagnosed. There's no purpose to seeking help, because again, it comes back. There's no structural and systemic incentives to do that. I mean, NDIS gets a lot of criticism in Australia in terms of the amount of money that it costs, the fraud that is associated with it. That's certainly there. But at the same time, it kind of has enabled Australia to actually provide supports and integrate people with disabilities into everyday life, probably more than any other country that I've been to.
Yes, I believe so. In general, agree with this system because it can prevent discrimination, and people with disability, any type of disability, needs to be supported by government, and NDIS is the best part of this support in Australia. And I wish we had the same thing in Iran. We have same thing, but it is nothing.
Even when
absolutely nothing.
Yeah, when I've talked with some of my friends who lived overseas, right, and they've come to Australia and they've lived here for a while, they'll make comments like they will see people in the community. They go grocery shopping or they go to a shopping center or whatever, and they'll see people with disabilities, just going around with support workers, with their families, with their friends, whatever. And they'll be like, when I was in my home country, just never see this, right? If someone had a profound disability, they would stay at home, the family would hide them. There was kind of a shame, like, oh no, we can't let our child go out and be seen. Yeah.
Exactly. Unfortunately, sometimes in Iran, you can be surprised by, for example, after 25 years, you can understand, for example, your friend got a sibling with disability. You never seen them. So it is really shame. Here they can't do anything. They can go out, just eat out, do the same activities the normal people doing. So this is really important and valuable, and you need to live in different countries to understand how it is important.
Yeah, I wonder why it is. Part of me wonders if it has to do with this, like Australia has quite an individualist culture in some ways, not in terms of like everyone keeps to themselves, but in terms of we really value giving each individual person kind of a lot of freedom and autonomy, and with that, and understanding that like each individual is worthy of like a lot of respect, I guess. I wonder if it is the case in some other cultures, such as Iran, some places that my friends have been from, where cultural conformity is much more important, and so we want to kind of hide things that appear like they don't conform. Can you share a memorable experience or case from your time in Iran that highlighted a unique cultural aspect of mental health treatment? How do you address language and cultural barriers when you're working with such a wide diversity of clients?
Well, I believe the strong therapeutic connection is often more powerful than just sharing the same language. In my experience in Australia, many clients from diverse backgrounds have specifically thanked me for the way I work. So, some even mentioned that their previous experience with local therapists were not that helpful. So, besides this, I know this barrier could be challenging for clients, so I have to do something more. For example, I'm using different pictures to explain what I mean. I'm just negotiation with them. For example, I'm telling in first session that English is my first language, and if you are thinking you are not understanding me, please let me know. I'm paraphrasing what they are telling to me. I'm using YouTube videos or TED Talks to discuss about sessions, about my goals, about the materials we are going to discuss about them in our session. So these help me to connect better. At the same time, I'm believing every day my English level is changing. I never will be a native English speaking like any immigrants, but yeah, we're just trying to progress. Sometimes even I'm using this challenge, this barrier, to show the client, look, I'm trying to learn every day. Or even for example, I have good memories of children in Australia. I'm telling, look, English is not my first language, and all of us are learning. So when you are here, you will teach me some English words, and I will teach you some other things, including my own language or some life skills. We will play. I try to show this communication is kind of connection, friend to friend, win to win. It is, I'm not, for example, a authority figure to teaching. I'm not a teacher. We are just sharing. So, for example, I mindfully just paraphrasing or repeating, wow, that sentence was a great phrase in English. Thank you for sharing that. I learned something from you. And I could see they are feeling good, even if they are, for example, under 10 years old. I'm using this challenge as an opportunity to build a stronger rapport.
I love that. So you take what is naturally seeming like a barrier, but you actually find ways to then use that as an opportunity to model to clients of how like you can confront challenges and use that for growth, but also just integrate that directly into your model of working with them, to kind of take it more down to that informal approach that we were talking about earlier, where they're sharing information with you, you're sharing ideas with them. It's not that you're just there providing a seminar on some topic and then they leave. Yeah, that's incredible how you've taken this, what is typically thought of as something that would be getting a roadblock, getting in the way, but you're actually able to use it to enhance the therapeutic setting.
Yeah, some of clients, for example, learned how to say, for example, hello or goodbye in Turkish or Persian language, and they used it, and it was just starting off fun, when they come and say you salam chetori, and it means they are practicing this, they are preparing themselves to come to see me and use these phrases, and it is really interesting.
That's really cool.
Or if I understand, for other nationalities, because as you said, here is multi cultures, and we have people from all around the world. And sometimes I'm asking questions, what do you say for example, this in Portuguese or in Italian, so they can share, and these connections just feel better between therapist and client.
That's really cool. I really love that. That's amazing. What advice would you give to psychologists who are interested in working internationally or with diverse communities?
Yeah, the thing that just we discussing about it, improving their language, English language is really important, and also they need to familiarize themselves with ethical guidelines and professional standards in the country they are planning to work, and they need to up to date themselves academically, learn new things, and just read more to stay up to date.
Yeah, one interesting thing that I found, I have a small subgroup of clients that will find me through my YouTube or social media, and some of these clients will then come to me because they would be the clients who are more scientifically minded. They like my research breakdowns and things like that. These clients will actually send me research every now and then and be like, hey, have you seen this? And it'll be my clients introducing research to me that I've never seen before, and that's been a really cool way for me to learn about topics where I've been like, how did you find this? Like, I haven't even seen this.
Yeah, one interesting thing for I forget to mention it. For behavioral activation, sometimes I'm asking clients to start reading, build new habit for yourself. So start reading a book, a psychological book. So some of them just asking some books, and I'm providing some lists by explanation. So one thing I'm telling them, you are welcome to send the summary of this chapter by email, or just discuss about it in next session. So this one updating me as well, and I'm not just feeling bad if I say, oh, this was first time I'm just seeing this, and thank you, you just teach something new for me. So when this happened, the clients trying to read mindfully.
Yeah.
Because they are going to teach you.
Yeah, that makes sense. It makes them actually have to engage in the context of what they're reading more, and not just like read it and flies out of their brain. They actually have to absorb the information because they know that you're going to be asking them about it. Yeah.
In one of the schools of thoughts, they say, if you are about learning, they say if you wanna learn most of material you are reading, by reading you will memorize only 10% of that. But when you are teaching what you learn to others, you will memorize, for example, 99% of that. So this practice could be really helpful. For example, the first thing I'm asking from childs in beginning of subsequent sessions, I'm asking them, what did you learn this week at school or at home, or the books you read? So maybe in first they say, well, I can't understand, but I put question in their head. During the week they will seek for learning new thing.
I really like that. So you'll have clients actually go and learn material, but with the understanding that they're going to teach it to you, because then it's going to increase their actual absorption of that information. When I was, I used to be a professional poker player, and that involved a lot of studying of simulations and game theory. And the best way that I would learn that is I would run through simulations and read about theories, and then what I'd do is I would create PowerPoint presentations as if I was giving seminars teaching each of the topics that I was learning about. No one would ever see them, but I had folders and folders full of like presentations that I'd essentially given to myself as a way of memorizing it and actually synthesizing that information.
Yeah. I used to work as a school psychologist back into my country, so purposefully sometimes when students ask question about something, I told them, I don't know, let's search about it. Give me time to read about it and explain you next session. I wanted to show them just telling I don't know is not bad thing. You don't need to feel shame if you don't know about something.
Yeah.
The way you are trying to find your answers matters.
Yes. Yeah, that's a great lesson. And I like that you mentioned as well that you'll tell some of the people, what have you learned the past week? So then if they know that they're going to see you again in the future, you're probably going to ask the question again. It makes them more mindful of actually noticing what they're learning and actually remembering that information, because they now feel like they have someone who's going to ask them about it.
Yeah, and this is part of solution focused therapy as well. We say, what was your takeaway from this episode?
Yes.
So we are trying to just help client to find some opportunity at their challenges.
Yeah, absolutely. I try to do this as well in my practice. Whether it's at the end of treatment or at the end of each session even, it'll be a reflection of, okay, what are we taking away from this today? What have we, what are some of the insights, or what have we learned, or what are we going to put into practice? What have we learned that we can make some changes with?
Yeah, and as you may know, just person-centered approaches like Erwin Yalom believes if you are not walking shoulder by shoulder of your clients, if you are not learning by your clients, you are not therapist. So you need to be open to learn. And one surprising thing about Iranian Yalom is he was around 90 something, and I was just listening to some of his YouTube these interviews, and he mentioned recently I was with my therapist, and I was like, what? So he's a father of a school of thought, but at the same time he's seeing psychologists. So it means we need to learn, even if you are a psychologist, in any age, in any level.
Yeah. I want to pull it back to my own experience here. When I was playing poker professionally, there was a consensus around my group of people that I would study with that if you looked back in time 1 month or 3 months, if you didn't believe that I was a terrible player 3 months ago, every 3 months, it means you were getting complacent and you weren't learning enough. And I found the exact same thing now in my personal life and with my clients. If they can't look back every 6 to 12 months and be like, wow, I've evolved so much, I'm such a different person now, I'm a better person now, I'm more living in line with my values now, every 6 to 12 months, right? It's kind of a sign that, hey, maybe you've gotten a bit too complacent, maybe you are like kind of falling behind where you could be. What do you think Western psychology can learn from Middle Eastern approaches to mental health?
Very good question. I think Western psychology can benefit from just Middle East or even Islamic countries, just the importance of community oriented and spirituality approaches to mental health, and the importance of family, faith, and social belonging. So in lots of situations we can see when it comes to spirituality, as you know, we have 5 dimensions to just assess when we are assessing client, and one of them biopsychosocial, spirituality, and sexuality. I believe spirituality is well recognized in cultures like Iran. So, for example, in lots of cases, we have nothing but a spirituality conversation with our client. For example, they are killing themselves, they are suicidal, but we are saying, do you believe this is according to your, for example, religious beliefs? And they think, not really. So we can't ask this question in Australia in these depths, but in Iran we can ask this. So family, the importance of family. We have lots of clients here, they are living by their own. They are happy with that, but in some levels they are feeling loneliness. But in Iran, even if you are at the age of 30, you are still living with your family, and this connection, I believe, it is kind of supporting factor, factor regarding depression and anxiety.
Yeah, it's very common here for people to move out of home kind of as soon as possible. That's just the societal expectation, the cultural norm. But it does lead to, unless people happen to have their family still live nearby, or they happen to make a family of their own, they have a partner, children, whatever, a lot of people can end up very isolated and very lonely.
Or, for example, we have some shared cultural and religious rituals, and when they are gathering together and just practicing, just listening, sometimes in some religious gatherings they are just crying together about something they believed about them, and it is healing for them in that context. Maybe if you are looking from Australian perspective, it is related to sadness, but they are feeling good in that gathering, you know. So it is a very obvious thing that the importance of social connections in treatment. So here, psychologist tries to help clients to go by themselves, but we know one of our responsibility is to connect or reconnect our clients to community. So there is a very important TED Talk I want to introduce here, how make stress your friend. So she's talking about two things. One thing is about how connection with others can help you to not die by stress related things.
Yeah, and that we know on some level, everyone knows that, you know, humans are very social creatures and we need that social connection. But it does seem like that gets lost somewhere in the process, right? In the psychotherapeutic process, or even in the cultural understanding in Australia, where if you have an issue, you need to have the strength to deal with it kind of by yourself, or it's seen as, you know, like, even if that involves reaching out to a psychotherapist in some way, that's seen as, you know, like dealing with your own issue. You go there and you learn the strategies and the tools, and then you handle it by yourself, right? And I wonder how this has come about, because even the root of most of our Western psychotherapy, you know, CBT, ACT, it's very much rooted in the Stoic philosophy and Stoicism as a tradition, where in Stoicism, right, it is very much, okay, act according to your ethics, act according to your values, be the best version of yourself. There is this ethos of individuality, but another core part of Stoicism is also acting in the best interest of community and having that social connection and endeavor there, right? It doesn't tell you to go live off in a mountain. It says to act in the best interest of your family and your community and your culture, because that is what ends up being the best for you. And so I wonder how it is that we've kind of reached a place where, in a weird way, we're very much pushing that off to the side, where we pay it lip service and we say things like, yes, social connection is great, you know, there's a loneliness epidemic, but then we don't really do anything about it. Yeah. Do you have anything that you'd like to share here at the end?
Yes, we discussed about lots of weaknesses of Iranian psychological associations, but I would love to share something interesting as well. The first important thing is, if you come to Iranian university, especially national university, you will be surprised how they are teaching in a very high standard level of psychotherapy or psychology. We have a great psychotherapists all around the world, and you can see some Iranian working here. They have in same level of knowledge compared to Australian or Americans, you know. And the other important thing that I need to share about Iranian culture is we have lots of rich literature thing that people, by reading book or listening in social media about this literature, these sayings, they can cope better. For example, about flooding technique in just treatment of an anxiety. We have a very interesting story or about exposure therapy. I learned it from a very short story for children in our old literature. So compared to Australia, because I didn't read Australian literature, but I'm familiar with my own culture, and I believe just studying or reading these resources directly and indirectly helping people, and they have knowledge how they can cope, you know, and this is really important. And one other thing that I just want to share with you, what we discussed in previous questions, is about the structure of families. The family is really important in Iranian societies, and if you are living in a family, even if you are suicidal, if you are feeling depressed, you have enough support. So I believe in some level, family is better than single psychotherapy sessions. So you are coming to psychotherapy sessions, you are talking 1 hour, and you are coming back 1 month later. But your family is with you, and they are supporting you, and they are caring about you. So this is good part of Iranian society that I wanted to share with you today.
I think that ties in as well a little bit to what I was mentioning earlier in terms of people have kind of two different ideas of what a psychotherapist is. One is that they fulfill this role of helping to essentially cure mental illness. The other is that they take on this role of helping people to live in line with their values and act according to goals and self-actualize. And I feel like in Australia, there's much more of a need for this type because there is more isolation from family and friends and religious culture and institutions, where otherwise if people are more connected with those things, then from their friends, from their family, from their religious cultures and institutions, they can be getting this reciprocal assistance to live according to values, to self-actualize, right? And so there's less of a need for a therapist to step into that role because they already have multiple other people and institutions fulfilling that role.
Yes, exactly.
Yeah. Excellent, Hasan. Thank you so much for the interview. I really found this interesting. It was really good.
Thank you.